Hello and welcome to Stretch Club. This is knee pain level 1. I have 3 goals for your knee pain today, and I will show you 2 exercises, an easy version and then a more advanced version. But the 3 main goals for your knee: healthy knees can flex all the way, like this knee is flexed all the way. I'll show you 2 easy ways to do that. You need to have strong hamstrings. Most of the knee pain is in the front for people, and hamstrings are the muscles in the back, and that will offset the pain. One of the big things I always see, people with healthy knees, they can flex their knees, they have strong hamstrings. And then 3 is hip extension. Oftentimes the knee does too much work, it hyperextends, it hyperflexes, and that often means the hip doesn't extend. So if your hip can extend appropriately, you have strong hamstrings, and your knee can bend all the way, it will take care of about 80% of your problems. So master these 3 things for your knees before you move on to part 2. I would also suggest the rest of Stretch Club, we're doing basic mobility and advanced mobility, where we do a bunch of hip mobility and knee mobility and spine mobility. As we know, the body is all connected. So all of the other classes are going to be helpful for your knee pain, but these are more specific. The first one is knee flexion. Okay, and so the end goal would be for you to be able to sit in this, what we call child's pose, with your knees fully flexed, and then ultimately allow yourself to go back like this all the way. Ultimately, you could get back down into a W sit, where you sit all the way back here. So this would be knee flexion and hip extension, and sit in this position comfortably for about 3 minutes. Now, that's sort of the advanced way to do it, and ultimately you'll just sit there. But if that is a problem for you and say, I can't do that with my knees, no worries. What you're gonna do is, perhaps because your knees are so tender, what we're gonna do is you're gonna put your knees on a pillow, and then you're going to slowly get a better shot. You're going to put your knees on that pillow, and then you're going to be up and then slowly go back down into knee flexion. Now, if you can't go all the way down, you might stop there and then come back up. But you're basically slowly working back so that your knees can flex, and you go all the way back. You hold it there for a second and then you come back up. But basically you want to work your weight down and then hang out there for a second and then maybe come back up. So even if you just go down and up and down and up, you're really working into that knee flexion, and that's what an orthopedic surgeon is going to test. Do you need knee surgery? Well, if you can flex your knees comfortably all the way, they'll say, hey, you probably don't need knee surgery. So this is another thing to do to help yourself avoid that knee surgery. You can start here. You could also go onto one knee and then rock back just like that on the one knee, okay? So this is really working into knee flexion. But ideally, you want to be able to sit there, go back into flexion, try to do about 20 or 30 of those, knee flexion, knee extension. But then again, ultimately, if you can maintain that knee flexion, sitting there comfortably, and then go back, they call it a W sit, keeping your knees extended, then putting your elbows back, and then ultimately laying all the way back there. That would be great. That is number 1. So master that. If you can master that, that will take a load of the knee pain away. But mostly, if your knees are pretty bad, you're going to be doing those knee ups and knee downs for quite some time until your knees get more comfortable in that flexed position. Now, the second one is hamstrings. Hamstrings are the muscles on the back of the thighs. The ultimate goal for your hamstrings would be to do what I call walking bridges. Excuse me, sinuses. Getting low for a little something here. But what you're going to do is do a little bridge, and then you're simply going to walk your feet out as far as you can, and then you're going to walk back. Now, that might be difficult, so first you might just walk out a little bit and walk back. But if you can walk, I like to keep your toes up, walking all the way out, and walking all the way back, and bring your heels all the way to your butt. Go all the way out, Walk it 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 out. Almost straight legged. Don't let your butt hit, and then walk all the way back in. Now, if you could do that 10 or 15 times, you would have a very strong hamstrings. Now, again, that's a little bit advanced. You can do that 10 or 15 times. You really feel the back of your hamstrings working. Great job. If you can't do that, then simply we're just gonna work on a bridge to start to feel your hamstrings. So put your feet up on a bed or a chair or something like that, and then simply just lift your butt up. Now, the error here is that most people lift their back up. Do not lift the back, just tuck your tailbone up. And this would be the most basic way to get your hamstrings to work. If you don't feel your hamstrings, wiggle your toes a little bit. The second way to feel your hamstrings is to lift one leg up. And so you're just on one leg. You should ideally sit here 10, 15, 20 seconds until you feel the back of the leg. Toe up, relax that. You'll start to feel the back of your leg there, and just let that hamstring cook. You should be able to hold this for at least 30 seconds. If you can hold it for 60, even better. If you hold it for 10 and then switch, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and switch. This will strengthen up your hamstring and help you offset the stress on the front of the knee into the hamstrings. Hamstrings are a huge one. If you have strong hamstrings, your knees are going to be super good. Ideally, I like the walkout. Sometimes it's nice if you have a foam roller and you just walk and under the foam roller. That'll really strengthen up the hamstring. So let me show you that. One sec, let me grab the foam roller. This would be the even more advanced version for the hamstring walkout. But you go here, walk the hamstring out all the way, and then all the way back. If you can do that 10 times over, all the way back, all the way is the toughest part. I don't even know if I have it. Anyways, do that 10 times. That would be strong hamstrings. Master those. And the last one is hip extension. So the best and easiest thing for hip extension, I think, is what is known as the couch stretch, where you put your shin back on the couch like this, and then you bring this leg up, and then you come up here, and you'll feel a stretch in the front of your quad, and ultimately you're going to get your pelvis and femur to extend on one another. Some people say this stretches the hip flexor. Maybe it does, maybe it doesn't. Most people feel it in their quad. You're getting good knee flexion, and you're getting orthopedic hip extension. That is really what you want to do. So most people won't be able to come all the way up like this the first time. You may have to stay down like this. Some people will have a chair or something to hold themselves up here, but you want to be able to stay in this hip extension position for at least 3 minutes. Sometimes people do it up against a wall, in which case you would need to get your shoulders back to the wall. And again, you would need to hold this position for 3 to 5 minutes. You'll feel a good burn in the front of the quad. That's usually where you feel it. And you want to try to keep your knee into maximum knee flexion, kind of like the first one. And then again, do it on both sides, but be able to hold this for 3 to 5 minutes. If you can stay upright for 3 to 5 minutes, you've got good hip extension, good quad flexibility. If that's too difficult, an easier version of that is simply going to be hip bridges. So we're going straight up like this. Now, most people will do it here. The big concern here is that I think most people use their back when they do this. So if you can go straight up and you do feel your glutes and your hamstrings, that's great. If you go up and you feel your back, that's not good. So you can use that as a regression, but most people should be able to do the couch stretch, the wall stretch, hip flexor stretch. It's a really great quad stretch. The first one, knee flexion, should stretch the quad, but this last one will do quads, knee flexion, and hip extension. Those are the 3 things that you need to master to get rid of your knee pain. This is part 1. Again, I would also suggest some of the mobility classes we have here in Stretch Club, especially if you have knee pain that's on the inside or the outside of the knee. There's going to be some involvement in your ankle or your hip. So these first few might take care of a little bit of it, but you might need some hip work, which we do every week in Stretch Club. Yeah, so that's all the stuff. If you guys have questions, please leave them below. Master these 3 basics for your knee, and then move on to part 2, and that will be coming next week. Thank y'all so much. Talk soon. Peace.